Hi, my name is Ressi. I'm an occupational therapist and certified lymphedema therapist. And today I have my friend and colleague, Carol Long, joining us today, who is also a certified lymphedema therapist and occupational therapist. The gold standard for treatment of lymphedema is complete decongestive therapy, which includes manual lymphatic drainage, compression bandaging, skin care, and exercise. Today we're going to talk about the importance of skin care as part of your complete decongestive therapy. Can you explain why skin care is so important?
Well, oftentimes what happens with the skin with lymphedema is that the acid mantle gets disrupted of the skin. The acid mantle is on the surface of the skin, and when you have a good healthy acid mantle, what it does is it reduces the risk of viruses being able to penetrate that skin barrier. And what that then does is neutralizes any kind of viruses. If you have issues with your skin when it's dry and it's flaky, that can increase your risk of infection. So we really push home the importance of skin care.
Prior to applying your compression bandages, we recommend that you apply a moisturizing lotion to your skin. Can you give us some recommendations of moisturizing lotions or creams that you would recommend?
Yeah, what we want to look at is we want to think about the pH of the skin, and the normal pH is around 4.7 to 5.75. So we want to look for a lotion that is not too high of a pH and not too low of a pH. If it's too high of a pH, the skin can become dry and flaky, and if it's too low of a pH, you can get redness and irritation. The problem comes when you're looking at your lotions, you're not actually seeing the pH on the bottle. So how are we going to know that? And aside from calling up the company, what we know is that if we look for items in the ingredients, such as if there is alcohol, if there are parabens, anything with a para, we want to avoid. And any kind of fragrances we want to avoid. Sometimes it'll say fragrance free, but it still has a fragrance in it. So it's very important to look for that. And then we know that that is the optimum level of pH.
Eucerine is one of the products that we recommend because it doesn't have any dyes, petroleum, or alcohol in it. Is there another product that you would recommend?
Yeah, we like to use Lymphoderm lotion. We know that that has a pH of around 4 to 5, so consistent with the skin. It also has properties in it that reduces the risk of infection and bacteria. It does have tea tree in it, and it is an all-natural product. It is an expensive product, so that is why we tend to go with the Eucerine, or we go with an Aquaphor or something along those lines.
What about sunscreen?
Well, sunscreen usually has a pH of around 5 to 7.5, and we know that we have to protect our skin when we have lymphedema, so sunscreen is vitally important. We don't want burns, especially if you have compromised skin due to radiation. And burning can also increase inflammation and circumferential measurements, so we want to be very careful with that.
And are there any specific precautions to using any of these products?
I think the main precaution is thinking about whenever we look at lymphedema, we have to think about more is not better. So it's the same with lotion. If we put multiple layers of lotion on our skin, the skin can tend to get macerated. So the skin can break down, and that kind of defeats the purpose of what we want to do, where we want to strengthen that barrier. So if you're putting lots of lotion on and your fingers are getting crinkly, or your hands are getting crinkly, and then you're putting on a little bit too much.
One thing I want to also mention is the importance of hygiene. If you have extra skin folds, you want to be sure that you lift the skin and clean it very well and make sure it's dry before you apply any lotions or creams.
Sometimes your doctor might recommend a barrier cream underneath the skin fold, and that typically has a zinc oxide in it. You would have to check with your physician first whether that's appropriate for you.
And a barrier cream example would be something like something you would use for a diaper rash?
Yes, like a Calmacet team, something like that, yeah.
Okay. So in summary, you want to practice good skincare and hygiene. Clean the skin very well and make sure it's dry. When you use a cleanser, you want it to be gentle so that it doesn't irritate the skin.
Right? And then the lotions should be free from alcohol, dyes, parabens, and fragrance.
And the two products that we did discuss were Eucerine and Lymphoderm, which you can find online, or Eucerine is often found over the counter in any of your local drugstores. If you found this video helpful, please subscribe, and thanks for watching.